The American Brain Tumor Association is pleased to welcome you back to our webinar series. Our webinar today will discuss navigating your medical care. This webinar is sponsored by Navio. My name is Umbreen Mann, Program Manager here at the ABTA, and I'm delighted to introduce our speaker. Tracy Edwards is an oncology social worker and patient navigator at the Brain Tumor Network, where she helps to provide high-touch navigation to adults with primary brain tumors nationwide. She previously worked with the hematology oncology, radiation oncology, and neuro-oncology programs at Nemours Children's Clinic, UF Health Proton Therapy Center, and Baptist MD Anderson Cancer Center. She is licensed in the state of Florida and holds oncology and advanced care planning certifications and is a qualified supervisor. Tracy became a social worker with the goal of advocating for people during some of the most vulnerable times in their lives. She has 25 years of experience addressing the unique needs of patients and families by ensuring that they are informed, respected, and heard. Thank you for joining us, Tracy. You may now begin your presentation.
Hello. Thank you all for being here, for your time and energy today. Thank you, Umbreen, for the beautiful introduction, and thank you to the ABTA for inviting me, and thank you for the Brain Tumor Network to give me the time and opportunity to present this webinar today. We are going to cover navigating your medical care. We're going to cover a lot of material, and we're going to cover 4 main topics. The first being understanding how to prepare for and navigate medical appointments. Then we're going to talk about shared decision making and move into seeking second opinions, potential specialized treatments, and then we'll end with talking about some in-home care, how to prepare for that and get some options for that. So next slide, please. You can go ahead to the next slide. I think we've covered this. I don't have anything to disclose, and we can go on to the next slide and get started. So how to prepare for and navigate medical appointments. Talking to your doctor can be difficult. Regardless of your diagnosis, hearing about it may leave you feeling frightened or overwhelmed. Good communication with your doctors and your healthcare team will improve the quality of care you receive. The best way to begin making difficult decisions about your healthcare is to gather accurate and reliable information about your brain tumor and to educate yourself about who is on your healthcare team. Know yourself and let your medical team know you too. Recognize your style of gathering information, retaining information, and acknowledge general and specific fears or worries. Perhaps you're afraid of needles. Perhaps you have anxiety around scans, MRIs, CT scans. Perhaps you're worried about changes in your appearance. Perhaps you're worried about your mobility, your cognition, your medical terminology, whether you understand it or not, finances, and role and identity changes. Those are some of the things that you want to communicate to your team so that you can come up with a solution together. Next slide, please. So let's go over your neuro-oncology healthcare team a little bit. I know a lot of you have a team like this, but I think it's important to go into what each person does a little bit and how you can advocate for yourself with these different team members. I've included a lot of team members here. It is not all inclusive. There may be others that are participants, and certainly we can discuss those in the chat if we need to, but I just wanted to go kind of quickly through this. Obviously, there's a neuro-oncologist, neurosurgeon, radiation oncologist. Those are often your doctors. There can be a neuropsychologist. So a neuropsychologist can do a neurocognitive evaluation. And that is actually very helpful to a lot of patients. It's an extensive 3 to 4 hour evaluation giving you a baseline as to some of your functioning, your cognitive abilities, can give you some ideas for employment and accommodations that may need to be made in your daily living. And so that is something, that's a way that you can advocate for yourself, is to ask for a neurocognitive evaluation if you think that would be helpful for you. A psychiatrist is often available on the team, a psychologist, and other specialists, ears, eyes, palliative care, we'll get into a little bit later. But there are other specialists that may be involved and on your team as well. Then there's your primary care physician, who you may or may not think of as being a part of that team, but often they can be very helpful. If you're already established with them, a lot of times they do a lot of symptom management. So while your oncology team is managing your treatment, a lot of times primary care physicians can be very helpful with things that you're experiencing, side effects to treatment. They can also be very helpful in getting referrals. They're familiar a lot of times with insurance companies and referrals that are needed for ancillary services. And I would just encourage you, if your primary care physician is going to make a referral, to let your neuro-oncologist know. They don't always automatically communicate, unfortunately, and that's one way that you can really advocate for yourself, is to have them communicate and let them know what the other is doing. Pharmacists. Pharmacists, actually, in some of the research I did for this presentation, pharmacists were not always listed on this health team. And I think that they are so vitally important. There are a couple of layers to pharmacy. So if you're receiving chemo, infusion, even oral chemo, there's usually a pharmacist with your cancer center who will provide education and tell you about that drug and the side effects and the benefits, and they will come in and they'll do education about the infusion. And they can help behind the scenes as well, as far as you getting the proper dosing and getting that ordered in a timely manner. They have a lot to do with that people don't realize. And then also, if your cancer center or your healthcare system has an on-site pharmacy, I strongly, strongly encourage you to visit it at least one time. A lot of people are used to using their community neighborhood pharmacy, but the pharmacy at your cancer center can actually have the pharmacists there know a lot about resources, especially with drugs that are controlled or specific to oncology. They can have those in stock for you. They can often do mail order as well. And they just know a lot of the ins and outs as to affording the medication. So if there's a high cost to a medication, they can look into a lot of those programs for you in conjunction with some of the other team members, such as financial counselors and social workers. But they have a lot of that inside information. And some pharmacies also have a 340B program, which is a significant discount, which the pharmacist should know about. And if you're having trouble affording a medication, they should be able to help you with that. We do know that medication adherence is difficult because you can't always get your hands on the meds right away. Some people visit 3 to 4 different pharmacies to get the prescription filled. So we want to avoid that, and that's just a really good way to do that. Nurse navigators. So we have a lot of nurse navigators here at the Brain Tumor Network who are working externally, very neutral, giving you literature and guiding some of the information that you're getting from your oncology team, and helping you find treatment centers, second opinions, and we'll get into that in a little bit. There's also often on-site nurse navigators at your cancer center who can help you, guide you through your care, help you get your appointments scheduled. They can often do things like that to help you kind of know what to expect. And also, oftentimes, through your insurance, there is a nurse navigator or a nurse case manager available. Often it will be offered to you if you have an illness such as a brain tumor, But if it's not, you can advocate for yourself and ask for it through your insurance company that one be assigned. Nurses, we love nurses. Nurses, there are so many different types. I've probably skipped a lot of it here, but obviously there's some hands-on care with inpatient care, nurses who administer chemotherapy. Most of your radiation oncologists are going to have a primary nurse assigned to them. Your neuro-oncologist is going to have a primary nurse assigned to them. And a lot of times those primary nurses are people that you can contact to help with symptoms, side effects, things that are going on with you, and they can communicate that to the physician. Triage nurses are important as well. They are often known as after-hours nurses. So if you call in the evening, you might get a triage nurse, but also some cancer centers utilize them during the day to field calls. And it's important to know that the triage nurse may not be as specialized as your neuro-oncology nurse in that particular field, so that you want to make sure that they are checking with your doctor and checking with your nurse, your primary. Social workers are one of my favorites. I'm a little biased, but social workers can do a lot of things. Mainly what we're trying to do is eliminate and help you navigate barriers to care. Anything that can get in the way of you getting treatment financially, transportation-wise, emotionally, coping with diagnosis and treatment and side effects and all of the changes that are going on in your life. We realize that your life doesn't stop because you have a brain tumor diagnosis, and that's not your only focus, and we try to incorporate all of that. Nurse navigators and nurses do too. There's a lot of really compassionate people on these teams. Chaplains are often available to you if you are interested in spiritual side of care. It doesn't necessarily have to be a religious focus. It can be more of a why did this happen to me, existential type of how can I find meaning in this type of interaction. They can also often connect you, if you have a specific faith, with someone who can provide care to you in the cancer center or specifically about your care. So if you want a priest or a rabbi to contact you, they can also often get in touch with them. And they also have, usually, inside tip, good resources in the community with churches, and a lot of churches are really available to help and support people in need. So that is also a good connection with the chaplains. A dietitian can help you to know good foods to eat, healthy foods to eat, answer questions that you have about what should be restricted or not. And they can also help you with bowel regime and things about your general health. So dietitians are often offered, but it's another way that you can advocate for yourself. If you are having some of those issues, you can ask to speak with a licensed dietitian at the cancer center. And a lot of the websites for nutritional supplements and things also have dietitian lines available that you can call in and talk. Occupational, physical, and speech therapy, rehab is available, often outpatient. I have worked in cancer centers where they'll even come up to infusion or during radiation, they try to coordinate those appointments. But it can be outpatient, it can be in the home. We'll talk a little bit more about that later. Radiation technologists are the people who are giving you the radiation. They're in the room or in the very next room with you when you're having the radiation administered. They're also often there to provide when you're in your simulation, having your mask made, they'll be there for that. Radiation technologists often form a pretty tight bond with people. They're seeing them every day. And it's often a little bit difficult when radiation ends because you lose your radiation technologist every day. So that's also something that we acknowledge, is that this is ever flowing and ever changing. It is good to connect with one person or a couple of people that you really can rely on and go to if you have points of questions. It's good to try to get an internal number if you can, or an internal email, so that you don't have to go through the whole phone tree every time. And we'll talk a little bit more about that. But it's kind of an insider tip to try to get that if you can. Of course, we want to respect the boundaries of the cancer center, but sometimes that's available, the office number directly to the neuro-oncologist nurse, or the office number to your insurance nurse navigator. So if you can get those numbers, that's a good thing to kind of seek out and write down and keep. Medical assistants often take you to the room. They will input information, update information from the last visit for the doctor. Art, musical therapist, yoga, all kinds of mind-body connection type of therapies are great to seek out, the type of programming. Some of it, unfortunately, has been limited by COVID, but it's still a wonderful way to cope and help you to adhere with your treatment plan by taking care of yourself as well, and also obviously a wonderful resource for caregivers. So these next four, I just really kind of want to piece out a few of this, because these four often get confused, and I just kind of want you to know what their role is. And because cost and insurance and coverage are important in your healthcare, it's important to know who these people are. So typically, not all places, but typically there's something similar to or called patient access, which is the check-in staff, the people who kind of, maybe they answer the phone sometimes. They'll input your information when you get there. They'll ask you to update your address, those types of things. They'll check you in for your appointments. Then there are schedulers, which seems self-explanatory, right? They schedule your appointments. Sometimes the checkout staff will put in, like the patient access staff will put in a request for the appointment to be scheduled. Sometimes those are one and the same, but sometimes they're different. So it's important to know that the person scheduling your appointment, unfortunately, may not be speaking directly to your doctor, and your doctor is saying, I want this and this and this to happen. It's an order, it's put into a system, and things can go wrong sometimes. So it's important to pay attention, to ask questions. When the schedulers call you, you can then have a follow-up call to your neuro-oncologist nurse or your radiation oncologist nurse to make sure that the details that you got were correct. Financial counselors are often available at cancer centers to, a lot of what they're doing is going over the healthcare coverage that you have, telling you what it will cover, telling you what it won't cover, kind of looking into maybe a little bit if you need a supplement, or you're eligible for some additional coverage. They might help you if you're looking at losing your coverage. Social workers really do that as well, and a lot of what we do is more on the end of, if you don't have coverage or you're anticipating not having coverage, we can help you to find a way to apply for Medicaid or marketplace plan, things like that. But the financial counselors are really kind of dealing with what you have, and then they will also often have the application for the charitable plan at the cancer center or the hospital that you're at, if they have that available. Sometimes that's only available inpatient, and that's something that Social Work Navigator can help you with as well, to kind of figure out that process. But there are a lot of people out there who get diagnosed or suspect that they are going to get diagnosed and don't have coverage. So that's another role that a social worker can help with. Billing, financial counselors can also talk to you a little bit about if you're looking for a second opinion, which we'll get into, and maybe you're looking out of network, or you need to do some self-pay or something like that. They can help you do that. Sometimes they can help you get an estimate. And then billing is the actual billers, the people who send you the bill and collect the bill. So if you get a bill, the number on there, you're going to be calling someone from billing. and talking to them about arrangements that you can make. Often they'll communicate with a financial counselor, but it's not always one and the same. So next slide, please. Tips for communicating with your healthcare team. So I actually moved this one to the top because I think it's so important. Bring someone with you to your appointments. I know sometimes that's not possible. I know sometimes that, especially with COVID, there are limits. Maybe you have to call ahead and say, hey, can I bring someone with me? How many people can come in? Even without COVID, sometimes they have limits on how many people you can bring into the exam room with the physician. But bringing someone to your appointment, it has so many benefits. Moral support, you're just not alone. If you're not feeling well or something unexpected happens, you've got a person there that you know to help you. It's another set of eyes and ears for a lot of information. If you receive unexpected, difficult news that day, it's a person to be there for you for that. Maybe drive you home, maybe give you a hug, those types of things. You know, COVID has changed things, and it is, and probably some of them will stick. It's more possible for a family member out of state or who just can't be there because they're at work to call in and be a part of the appointment by the phone. A lot of the appointments are even done telehealth, so you can be at home and be talking to the physician. And I like that as an option, but I always say if it's possible to take someone with you to your appointment, it's a great idea. And I've known some patients who have purposely actually gone to their appointments alone with the idea that it's a burden on their caregiver, or that they don't want the caregiver there to receive the bad news. But I don't know that if you really talked to the person who would go with you, if they would agree with that. And I think it's important to keep that open communication and to have everybody hearing that news at the same time, if at all possible. Remember that you're the consumer. So in this day and age and world, you have choices, and some of those include cost, some of those include convenience, some of those include what you can make happen or not make happen. So you can make requests. It doesn't mean that you're always going to get them. You can try to work out scheduling so that you have appointments on the same day, or if you don't like to have as many appointments on the same day. As a lot of you know, sometimes you'll have labs the day before chemo, and you'll be waiting for the lab results, and things can change. But you know, there's a certain amount of it that's outside of your control. But in addition to being a patient, you are a consumer of a healthcare product, and that's important to remember, because we'll talk more about that in your shared decision making. But you're a part of this, and you get a say. It's good to keep a healthcare binder. You can do it in a laptop, tablet. You can use your phone. There are apps you can use, but it's important to have somewhere to collect information and kind of keep it all in one place. You can designate someone to do that for you if you're not good at it, or you just don't want to. A lot of places, cancer centers will give you binders. I think the American Cancer Society, I think they still do, I don't know, but for a while, if you registered with them, they would send you a binder. So that's available. There are some nice, actually one of the resources that I list today, there are some nice medication charts and things you can get online. There's apps that'll help you keep track of your medications. So a lot of that is available. So it's important to prepare a list of questions before you go to see the doctor. And I was just recently on a call with our brain bank. They have chats on Tuesday for patients with glioblastoma. And this week, their guest was, last week, their guest was Courtney Burnett, who is a physician who was diagnosed with a brain tumor in January of this year, if I'm correct, in Thailand. She's an internist. Fortunately, she had a lot of medical knowledge, but if you can imagine being alone in Thailand and being diagnosed. And someone during the chat, she told a lot about her story. She has a blog. She has a book coming out called Difficult Gifts. But someone asked her, in fact, it was a patient's caregiver daughter, asked her during the conversation, what's the best way to advocate for yourself? Being a physician and a patient, what's the best way to advocate for yourself? And she said, keep a running list of questions. She keeps a running list of questions in her phone. And she also keeps a journal and keeps track of her symptoms, things that change, things that are going on or seem strange to her. So that spoke to me that a patient and a physician was advocating so strongly for that. So prepare a list of questions for your doctor. Write down your doctor's answers because it's likely that you're not going to remember all of them when you leave the room. Consider recording the visit if your doctor allows it. That's really up to you. Back to that first slide that we were at, your style, your preference is often a consideration there. And then if something's unclear, you can repeat it back. This is what I heard you say, Doc, is this correct? I didn't quite understand that. Can you please explain it one more time? That type of thing. And then advocate for yourself and speak up. Talk about what's happening with you and what you want to be happening with you. I always hear the question, Doc, hey, if this was your spouse or your sister or your brother's cousin or your grandmother, what would you do? And I think perhaps I understand the purpose behind that question. It's kind of maybe to get some empathy and really hardcore put it to the doctor about what's the right decision here. But really, you are a part in that decision, and you don't want to take yourself out of that loop. So a more relevant question might be, Doc, in your expert opinion, is this a good treatment for me? Is this treatment going to be worth it for me? How effective do you feel this treatment will be for me? What literature do you have to support this? And so those are kind of what I'm talking about when I'm talking about questions for your doctor. And then it can be little things like, you know, will I be able to still go to work? Those types of questions. Okay, next slide, please. So topics you may want to talk about. Obviously, the nature of the tumor. You can ask for details about your tumor, the grade, the stage, the type, biomarkers. That's another way you can advocate for yourself, is to have genomic testing. You can ask about genetic testing. So you can really explore, you know, the tumor type and what your doctor believes about that to the extent that you want. And there's other ways to get information about that. We'll go into that in a little bit. Possible treatments, time frame for the treatments, medical tests and procedures that are involved. It's also important when you're scheduling those medical tests and procedures to ask questions like, can I eat before? How long is this going to take? You know, can I take my medications with this? Is there anything that's going to cause me a problem? So those are just good ways. Those aren't things that they always go over. Sometimes they'll call and schedule the appointment, and then they won't tell you that somebody else is going to call you and give you all those details. So you're just kind of left hanging. So, you know, it's just important to advocate for yourself and ask those questions. Medical team contact information, we've kind of been over that. It is important to ask, hey, if it's 5:30 and I have a seizure, what do I do? You know, if it's in the middle of the night and I feel like I'm having a side effect from a medication, what should I do and to what degree? And so those are always important. And it's also important to find out, how long is it going to take you to call me back? Like, what's the expectation that I should have if I call this number for someone to call me back? Also, obviously, there are patient portals that you can utilize. Some of those work better than others. some people are able to work those better than others, and they have some drawbacks as well. What to expect during and after treatment, prognosis and the outcomes of treatment, potential lifestyle changes, and how to handle medical emergencies. Okay, next slide, please. So in one of the first slides, we discussed how to, make decisions. Is part of that is getting information about your diagnosis. As we all heard doctors say, or someone advise us, don't Google it, don't go look it up. But that's just obviously you want to be informed about your diagnosis, but you want to be well informed and you want to get reliable and good information. So I have just listed here, I'm not going to go into them too much depth, but these are some of the resources that we actually use here at the Brain Tumor Network to educate ourselves, to educate new employees, to educate patients, and also the American Brain Tumor Association has a lot of publications on their website that are very helpful and in language that's easy to understand. One of my favorite from them is Returning to Work. And so I put that on here because I like it. And it's a very helpful tool because a lot of people are left, wondering, okay, well, last week I was working, this week I have a brain tumor, what do I do now? So that's a helpful tip and tool, and obviously there are other people as part of the team who can help you navigate that as well. Brain Tumor Navigators also do literature searches. We work with primary brain tumors and adults who are diagnosed with them all the time, and a lot of common themes come up. So we'll keep those articles in a library and we'll utilize them for patients that it's applicable. If we don't have anything, we'll go look for more. A lot of the literature that we rely on is based on results of clinical trials. There is some pre-trial or pre-human information out there. That's probably going to be things that you hear about, but that might be a little early because you're looking for treatment now. So we can help you to look at that timeline and kind of guide you as to what literature to look at. There's a couple of books listed here that are wonderful guides, and there's a caregiver resource manual it's got so much information. It can be a little overwhelming, but it is just so detailed. It's through the university, UCSF health.org, and that's available. And we often share that information with caregivers and people who are newly diagnosed with brain tumors as well. Okay, next slide. I'm going to move on to shared decision making, which is defined as a collaboration between patients and their clinicians to reach an agreement about a health decision involving multiple medically appropriate treatment options. So basically, it's a collaborative decision between you and your caregiver and your doctors and that whole team that we discussed. And it really has been shown to increase patient satisfaction, to have better adherence to treatment because you understand what's going on and why you're being treated, greater treatment engagement, and better quality decision making. Next slide, please. So I added this little cute cartoon. All of my decisions are wrong, so I've decided to stop making decisions. And then Garfield says, good decision. So we all know that sometimes not making a decision is a decision in and of itself. And we want to make sure that, that's not because you're avoiding making that decision or because you don't have the information that you needed to make that decision. And that has been a challenge in the healthcare system through the years. The American Society of Clinical Oncology states that the key objectives of shared decision-making are achieved when patients are fully informed of the treatment options and the trade-offs between rights and benefits, and the patient values and preferences are incorporated into the treatment decisions. So I want to talk to you about what I want this to look like. I'm the patient. I want to talk to you about what I want this to look like. I'm the caregiver. I want to talk to you about what I want this to look like and what's reasonable for our lives and what works for us and what our end goal is. And I think that that's so important to have that ongoing shared decision making is really an ongoing conversation because things are changing. You're diagnosed, but then things are changing. Treatment decisions are changing. So that's an ongoing conversation that happens throughout your communication with all of your physicians and your oncology team. Okay, next slide. Patient-centered care makes me giggle a little because it was a buzzword that I started hearing, I don't know, maybe 10, maybe even 15 years ago. And I thought to myself, shouldn't the care always have been patient-centered? Like, why is this a breakthrough? But what it really means is that you are having a choice and you're not just stuck with, okay, this doctor says you're going to do this. You really have a say. You have a right to be educated. You also have a right to say, hey, doc, I really want to trust you on this decision. What do you think is best? That's okay. But we want to have the opportunity to be informed. Treatment recommendations are based on complex clinical information that is revealed as it changes over time after initial diagnosis. So that's what we were just talking about. Continue that conversation. Integrating this information into a treatment plan is challenging as different specialists direct various treatments. So we talked about that whole team. There are additional specialists on there, and it's hard to keep everybody in contact and communicating. Clinicians have an ethical responsibility to include patient choice into treatment decision-making because it's the patients and their families that are ultimately subjected to the outcome of these decisions. And then there is strong evidence that more engaged, informed patients are more satisfied with the clinical encounter and have better psychosocial and sometimes clinical outcomes. Next slide, please. So some of the cautions in shared decision making are that sometimes you feel pressure and distress about to make the absolute right or absolute wrong decision, and maybe it's not that clear. You can have patients and caregivers and families disagree amongst one another with the physician. You can have suboptimal time in the exam room, feel pressured. That's why you write down those questions, freeze up, tune out. That's why it's good to have another person there with you listening. Complex decisions with no prior experience as a guide. So you just really, you just feel like you just got thrown into this, and how do you know where to turn or who to look to or what information to get? High potential for mismatch of information that's needed and what's available and delivered. And then sometimes treatments are given that physicians don't really feel like will be of any benefit, but they want to kind of help the patient feel like something's being done. And I really feel like there's a place for some honesty there and some real honest discussions. And sometimes a palliative care doctor can help with that. Sometimes a primary care physician who's trusted with the family can help with that as well. Next slide, please. So what can help? Well, just so happens that the Brain Tumor Network has navigators who can provide answers to the questions that are specific to your diagnosis and assist with locating brain tumor experts and resources both close to home and nationwide, facilitate second opinion consultations and management of your personal health information, conduct in-depth personalized clinical trial searches, and recommend ancillary and support services throughout the duration of your care. There are also tumor boards, which is a way of communicating amongst all the specialists and the doctors that are on your team that we discussed at the beginning. This is actually kind of exciting with COVID. It's getting expanded with the virtual abilities that they have now for more and more input and specialists, and they're going to review your pathology, they're going to review your scans, and they're going to talk about what the best treatment plan is for you and if what your doctors come up with is a good one. And so Another piece of, I really feel like this is a piece of shared decision making, is advanced care planning. Having a healthcare surrogate or someone designated to make decisions for you if you're not able to, and putting that in writing early on is a good idea. And also, there are documents such as honoring choices, first steps, respecting choices, that are becoming more and more accepted nationwide. Right now, a lot of those documents are state by state, but a lot of them are universal. And you just have to make sure that it's witnessed or signed in the state that you live in to be effective legally. And then if we can go to the next slide, I'll talk about the GBM Bill of Rights. So the ABTA is in support of this. The Brain Tumor Network is in support of this, and our Brain Bank, which is an organization that was founded by a patient, a glioblastoma patient. And obviously our Brain Tumor Network, our founder is a caregiver of a brain tumor, a patient with a brain tumor, a long-term caregiver, and she's also involved. And then of course I mentioned Courtney earlier, but what I love about this is that this glioblastoma Bill of Rights came together with patients and advocates developing what they want to see in care and what's important to them in care. And it really gives patients and caregivers, it gives them meaning, and it gives meaning to their experience by being able to pass along information and help others. So next slide, please. It is your right to have a second opinion. A second opinion is when you ask your doctor, when you ask a doctor other than your primary doctor or regular doctor for their view of symptoms, your illness, and it'll help you make a better informed decision of your treatment. You can also get a confirmation of your diagnosis, a consultation with a brain tumor specialist. So that's something that is important. Brain tumors are rare. It's important to get connected with someone who has treated them and has information on them. A lot of times we can help guide you to a brain tumor center of excellence, or you can look those up. And that's on the next slide, please. So there are, the ABTA actually has a link to help you find a brain tumor center of excellence, which is basically an institution that has a designated brain tumor program and ensures that there are trained neuro-oncologists, neuropathologists, neuroradiologists, neurosurgeons, and radiation oncologists who specialize specifically in brain tumors and work collaboratively. These centers have opportunities for clinical trials often, research, and a variety of treatments that may not be available at your local center. The National Cancer Institute is also a valuable resource. Your physician can consult with the NCI for case review, and you can find a list of NCI comprehensive cancer centers at that link. It's important to consider the distance that you will go if you're able to travel, and often remote second opinions and consultations are available. And so I just wanted to say that sometimes those are private pay, and also second opinions, if you have private insurance or a Medicare Advantage plan or Medicaid, you will need to check with them and see. It should be covered for a second opinion, but you have to kind of navigate where your insurance will approve for you to go. Next slide, please. We're really not talking about clinical trials today, but I did want to include this graphic because I think it's a good way to sort of navigate points of care, and it's just a good illustration of points of care when you could consider a clinical trial. These also might be good points of care to consider a second opinion or a consultation about your next step in treatment. So, you know, obviously when you're newly diagnosed, if you have a recurrence, if there's tumor progression, there are points after standard of care. If you progress through treatment, there are points in your care where we can look, and you can look for specialized referrals and clinical trials and alternatives or second opinions. Next slide, please. So just quickly, I'm going to run through in-home care. I do feel like we're able to really feel great when we're at the doctor, feel supported, and then we get home and sometimes we're like, oh my gosh, what do I do? So there are different types of in-home care. Obviously, it's helpful if you have a primary caregiver that can be a family member or a spouse. They can get Family Medical Leave Act. In certain states, they can get paid to be your caregiver. It depends on state, and it's not as readily available as I would wish it could be, but it is available in some states. You can utilize volunteers, organized church community. It's good to, if people are saying, can I help you? It's good to give them a specific time and date and how they can help. Skilled home health care is often covered by insurance and can include a nurse, social worker, OT, PT, ST, home health aide, but is limited usually to the amount of visits that you can have per year, and you need a skilled medical need. Private duty, higher care can be private pay, veterans aid and attendance, and you can also sometimes utilize long-term care policies, critical illness policies to pay for in-home care in that manner. Palliative care is often a consultation. Right now during COVID, I think a lot of it is telehealth. It's usually with a nurse practitioner or a PA, and they will advise you on symptom and pain management. A lot of times they're consulting with your PCP or with your oncologist. Hospice care is available in-home, usually at very little cost to you or no cost to you. It's usually covered benefit, and can provide all kinds of really wonderful care. It is for people who are diagnosed or whose prognosis is 6 months or less in general. That doesn't mean they necessarily kick you out or don't let you in if they think it might be a little bit longer, but that's the guideline. And they can provide a lot of equipment in the home, and they can provide an umbrella of services for the patient and the family. And then there are meal and grocery services, Meals on Wheels, there's meal delivery programs, there's a lot of online programs now that deliver and will cater to your special dietary needs. Next slide, please. Just considering safety at home, looking into what to do again after hours. Should I call non-emergency? Should I call emergency? Should I go to the hospital where my cancer center is located, or should I call 911 and go to the nearest hospital? Those kind of questions are good to ask in advance so that you're not freaking out in the emergency and not knowing what to do. Transportation, is it safe for the patient to drive? You can apply for a disabled parking application. You can get some equipment in the home through insurance. Some it doesn't cover, but you can purchase or get it from a loan closet, which is often quality equipment that you can get for free. Wheelchair ramps you can have built, or you can actually rent them. Shower rails, things like that. There's actually an agency here in Florida that it's a couple, and he'll come in and do an eval, and then she's a physical therapist, and they kind of make recommendations for renovations for your home. There is usually a cost to that. Insurance doesn't always cover that. And then obviously COVID-19 concerns and precautions, to find out what is the home care policy with those, and how are we being careful, and what are our concerns. So next slide, please. So these are just some specific links that I like. They're relevant right now. This is certainly not comprehensive of all the support and caregiver tips out there, but these are just a couple that I liked to include today, because I like this cancer.net link because it really talks about some practical tips for managing attention, thinking, memory problems. A lot of that is what happens in the home. The caregiver's frustrated because they need to leave a meal for the patient and they left it in the refrigerator, but he didn't eat it, or she didn't eat it. And you know, it's simple things like we can talk about just labeling this lunch, and maybe that will help, or putting it on the counter instead of in the refrigerator. Cancer Care has wonderful programming. Their whole website and their helpline is very supportive of brain tumor patients. They have specific brain tumor support groups, brain tumor caregiver support groups, and right now actually starts today, and I don't know honestly if registration is full, but they have a web workshop series that's starting. And then obviously the American Brain Tumor Association is an excellent resource for educational brochures and information. So thank you so much. I think that I am going to send it back to Ambreen and see if we have any questions.
Thank you so much, Tracy, for your insight and expertise. We do have some time for questions now. As a reminder, if you do have questions that you'd like to ask, please type and submit it using the question box in the control panel on the right-hand side of your screen, and we'll answer questions as time allows. So Tracy, one of the first questions we have here is going back to some of the advice that you shared. You had mentioned that it's really important to bring someone with you when you go to your appointments and your checkups. With COVID-19, unfortunately, a lot of patients are having to go to their appointments alone and not bring someone with them. One of our attendees actually shared some great advice of when you can't have someone physically with you, it can be helpful to be on the phone with your loved one while they're at their appointment. Do you have any other advice that you can share with patients who are having to go to their appointments alone, especially during the pandemic now?
I do. I've had a couple of experiences with inpatient. So inpatient hospitalization, when you have to go inpatient, is even more restrictive than outpatient, at least in my experience. And oftentimes, patients that are inpatient are not capable necessarily of utilizing their phone for a FaceTime or a teleconference interaction. I know in a lot of the hospitals, the chaplains are taking iPads and and phones to rooms so that patients can have an interaction with a caregiver on the outside or at home. We've all seen those heartwarming videos of like the husband or the spouse or the significant other outside the window of the infusion center holding up a sign saying, "I'm here for you, baby, even if I can't be in there with you." I do think recently, I don't know what's going to happen. Things could change again, but recently they have been allowing one visitor in the infusion centers, but again, that can change, and it's center to center. I do think sometimes concrete mementos you can just take for moral support, and then you can also utilize the staff at the center. So if there's someone that you have a connection with that's working there in the center and that's wearing PPE, they can accompany you to your appointment, or at least touch base with you during those times. So that would be my recommendations for that.
Great, thank you so much for sharing that wonderful advice. Another question we have is asking if you can please share some tips or advice for long-term survivors or long-term patients who might be coping with late effects from their treatment or their brain tumor. Who can they turn to for support, or how do they find a doctor or physician that can help them with their unique issues?
I think that is a really good question and a complex one. In recent years, there has been a lot of development in survivorship, and there are now requirements putting in place survivorship care plans. There are some challenges with that as well, though, because oftentimes insurance can change. You don't have coverage for some of the recommendations that they make, things along those lines. So, but the survivorship coordinator can really help you. And I think we as survivorship care plans become required, it sort of moves slowly, but as they're required, some of those developments are going to be made so that we can address, and insurance can address, some of those late term effects. And I think that also it's good to have some psychosocial support, some like the yoga and the art therapy and the music therapy that I mentioned before. If that's something that you utilized during treatment or shortly after, that's a good way. Also, support groups are wonderful. They welcome survivors to come back and share a wealth of information that they have gained through their experience with others. So there are some ways to connect. I think the health challenges of late-term effects are a problem, and probably I would think that the best way to address that right now would be with a PCP or a primary care physician. I think that that's another reason to stay connected with your primary care physician during your oncology care. And also, I had one more thing to say and I forgot what it was. Oh, fear of recurrence. So obviously fear of recurrence is a very real thing during treatment, but also something that a lot of long-term survivors carry with them. There's a lot of literature out there on fear of recurrence, and there are some podcasts and some good online resources for that as well.
Thank you so much, Tracy. Earlier in your talk, you talked about how it can be helpful to have a folder or a binder where you keep your notes and information. And you also mentioned that there's apps that can help with keeping and maintaining your medical records. Are there any apps that you can recommend to our attendees today?
Oh gosh. Not off the top of my head, but certainly, let me think. Well, our brain bank actually has an app that help you track your symptoms, and they're actually collecting that for research purposes, but it does have a possibility of you know, having some benefit to you as well to see what's been going on. And then there are a lot of medication apps that are out there that help you track your medications and set reminders for you when you need to take them, and then you can tick off when you have taken them. So those are very helpful. I know a lot of like iPhones have health sections now where you can keep a lot of your health history. Back in the day, this is probably dating myself, you could actually order a jump drive and download all your health information onto the jump drive. I think that might be a little outdated now, but you know, I could certainly do some research on specific apps, but I can't come up with any off the top of my head right this second, other than those.
No problem. Thank you so much. And now going on to the topic of second opinions, if a patient were to seek a second opinion and they receive differing information from each one, can you share advice on how they can choose which one they should go with?
That's a good question. One of the ways that you can get some information on who's giving you the opinion oftentimes is to go to the website of the Cancer Center, Brain Tumor Center of Excellence where they work, and you can actually click on, or you can search neuro-oncology, and all of the physicians there will pop up. And then if you click on full profile, which is basically kind of advertising that particular physician or giving the resume for that particular physician, there will often be publications that they have written or contributed to, and you can really look into how much experience they have and research they have, and so that helps you to kind of get some information on who's giving you the opinion. Obviously, being a social worker, you know, other things can come into your decision as well. What's going to be the most reliable and reasonable treatment for me? Is it more important for me to be close to home? Is it more important for me to have loved ones nearby? Or is it more important for me to really go for it and try this thing that seems like the best treatment for me? So all of those are considerations, and obviously COVID has come into those decisions as well. traveling by plane, driving in a car, you know, where are you going to stay, those types of things. But yeah, I would say that looking into where the second opinion is coming from and feeling who you trust the most and who you feel the best about. Obviously, your navigator can talk to you about those opinions and translate and interpret some of that information that you get from those opinions. And some of it is just going with your gut and really talking to your family and having conversations about what's important to you.
Thank you so much. That is wonderful advice. Unfortunately, that's all the time that we have for questions today. Thank you all so much for joining us. And thank you once again, Tracy, for your wonderful presentation and taking the time to share your insight with us.
Thank you.
And a special thank you to today's sponsor, Navio. Aside from our educational webinar series, the ABTA has a variety of programs that offer support for patients and caregivers throughout their experience. For more information about ABTA's programs, events, services, visit ABTA's website at abta.org, email us at info@abta.org, or call the ABTA Care Line at 1-800-886-2282.